If you qualify for both Medicare and Medicaid, there is a type of plan that was built specifically for you. And there's a very good chance nobody's ever told you it exists. It's called a DSNP, a Dual Special Needs Plan. And it does something that no regular Medicare plan does. It takes your Medicare benefits and your Medicaid benefits and coordinates them into one single plan, which has one card, one phone number, and extra benefits on top that you won't find anywhere else. I'm talking about transportation to your doctor's appointments, a monthly allowance for over-the-counter products, healthy food items, meal delivery, dental, vision, and hearing benefits that goes way beyond what standard Medicare offers. I'm Andy Childs. I'm a Medicare broker in Mesa, Arizona, and I've spent 7 years specializing in exactly this, the DSNP market. So let me show you how it works. I want to be upfront about something before we go any further. The dual eligible population, being the people who qualify for both Medicare and Medicaid, is one of the most underserved groups in the entire health system. You navigate more paperwork, more agencies, more phone calls, and more confusion than most anyone else on Medicare. And you get less help while doing it. Most Medicare agents don't specialize in DSNP. Most of the information online about Medicare focuses on people who have Medicare only. When you search YouTube for Medicare help, almost everything you find assumes you don't have Medicaid. That's not your situation. This video is for your situation, and I'm going to treat it with the depth it deserves because I've spent my entire career working with people exactly like you. This is not a side topic for me, but it's the main one. Here's what I see happen over and over again. Someone qualifies for both Medicare and Medicaid. They get their Medicare card. They get their Medicaid card. In Arizona, that's Access. And when they try to figure out the two programs together and how they work, they call Medicare. Medicare says, we handle these services. They call Access. Access says, we handle those services. And they're left in the middle trying to figure out which card to use where, which program covers what, and what happens when they overlap. I had a woman in South Mesa, 64, on disability. She qualified for both Medicare and Access. She'd been dual eligible for 3 years. She'd had 2 separate insurance cards, 2 separate provider directories, and 2 separate customer service numbers that gave her different answers to the same questions. She told me that she'd missed 3 specialist appointments in 1 year because she couldn't figure out which program was supposed to cover the transportation. One time, Medicare told her it wasn't their responsibility. She called Access. They said they didn't have her transportation benefit set up because they thought Medicare was handling it. 3 missed appointments, not because she didn't want to go, but because the system made it too hard to get there. That's the problem DSNP was designed to solve. So let me show you how. DSNP, a dual special needs plan, is a specific type of Medicare Advantage plan that is only available to people who have both Medicare and Medicaid. So let me break that down. It's a Medicare Advantage plan, which means it's offered by a private insurance company and approved by Medicare. It includes your Part A and Part B benefits and usually includes prescription drug coverage as well. But here is where it's different from a regular Advantage plan. A DSNP is designed to coordinate both your Medicare and your Medicaid benefits under one plan. Instead of 2 cards, 2 different numbers, and navigating 2 systems, you get one plan that talks to both programs for you. Your DSNP plan becomes your single point of contact. They handle the Medicare side, they handle the Medicaid side, and they add extra benefits on top that exist specifically because you are dual eligible. I had a gentleman in Tempe, 71. He'd been dual eligible since his late 60s. He'd been on a regular Medicare Advantage plan for 2 years. Good plan for most people, but it was not designed for someone with Medicaid. He was still calling Access separately for certain benefits. His plan didn't coordinate with Access at all. He was leaving benefits on the table that he didn't even know he was entitled to. Transportation, food allowance, expanded dental. So I moved him to a DSNP. Same $0 premium, same doctor network, but now his plan was purpose-built for his dual eligible status. His transportation benefit was handled through one phone number. His over-the-counter allowance showed up automatically. He told me it was like someone finally built a plan that understood his situation. That's the key difference. A regular Advantage plan can work if you're dual eligible, but a DSNP is built for you. And the extra benefits exist specifically because the plan is designed to serve people managing both programs. Now let me get specific because extra benefits is a vague phrase and I don't do vague. Transportation, rides to and from doctor appointments, the pharmacy, even the hospital. This is coordinated through the plan. You call one number and they schedule the ride. Over-the-counter allowance, a monthly or quarterly dollar amount, usually somewhere between $25, $100, $200, depending on the plan, and it can help you buy over-the-counter health products. Meal delivery. After a hospital stay or a qualifying health event, some dual special needs plan deliver meals straight to your home. If you're recovering from surgery and you can't cook, this benefit covers you. Expanded dental. Most regular Medicare plans give you basic preventative dental at best. Many DSNP plans include more comprehensive dental, cleanings, fillings, extractions, and sometimes even dentures. Vision, annual eye exams plus an allowance towards glasses or contacts. Hearing, annual hearing exams plus an allowance towards hearing aids, and this one's massive. And finally, care coordination. This is the invisible benefit that holds everything together. Your DSNP plan assigns a care coordinator who helps you navigate appointments, referrals, medication management, and even communication between your providers. There's a real person you can call. I had a woman in Mesa, 73, been on a basic original Medicare with access for years. She needed hearing aids, but couldn't afford them. Original Medicare doesn't cover hearing aids, and the access coverage for hearing aids in Arizona is limited. So I enrolled her in a dual special needs plan that included a hearing aid allowance. She got hearing aids for the first time in 6 years. She called me after her first week wearing them and said she could hear her grandchildren on the phone without asking them to repeat themselves. That's a benefit designed for people on limited incomes who've been told no by the system for too long. That's who DSNP is for. Here's the most important question. Do you qualify? The basic eligibility requirements is straightforward. You need to have both Medicare, A and B, and full Medicaid benefits from your state. In Arizona, Medicaid is called Access, the Arizona Health Care Cost Containment System. If you have both a red, white, and blue Medicare card and an Access card, you are very likely eligible for a DSNP. But here's where it gets more nuanced and why talking to a broker matters. There are different levels of Medicaid eligibility, and not all of them qualify you for every DSNP plan. Some people receive full access benefits. Some receive partial, like QMB Plus, Slim B, or QI programs that help pay Medicare premiums but don't provide full Medicaid coverage. If you're not sure what level of access you have, you can check through your Access online portal, call Access directly, or, and this is the easiest path, call a broker who works with DSNP plans and let them verify your eligibility. I had a client, a veteran, who was in northern Mesa. He had Medicare through disability and he knew he had access, but wasn't sure what category he fell into. He'd call Access twice and gotten 2 different answers, so he was ready to give up. I pulled his eligibility in 2 minutes. Full dual eligible. Qualified for every DSNP plan available in Maricopa County. He'd been missing out on transportation, over-the-counter, dental benefits for over a year because nobody could give him a straight answer. If you think you may qualify, or if someone in your family might, don't try to navigate the verification process alone. A broker who specializes in DSNP can check your eligibility faster than the state hotline, and it costs you absolutely nothing. Here's the summary. If you have both Medicare and Medicaid, in Arizona that's Medicare and Access, you may qualify for a DSNP plan. A DSNP plan takes both programs and coordinates them under one plan, one card, one phone number, one care coordinator. On top of your Medicare benefits, you get extras designed for dual eligible individuals. Transportation, over-the-counter, meals, dental, vision, hearing, care coordination. Eligibility depends on your level of Medicaid coverage, and verifying it takes less time than you think. So, especially working with a broker. This is the topic I care most about. I started working with dual eligible families when I was 20 years old. And 7 years later, it's still the thing that gets me up and out of bed in the morning. Because the people who qualify for these plans are the ones that the system forgets about the most. And they deserve better. If you're in Arizona and you want to find out if you qualify, call me. It's in the description. It's free. It's what I do. Subscribe because this is just the beginning of the DSNP conversation on this channel.